So immunotherapy is a way of encouraging the immune system to recognize and respond to allergic proteins differently so that you don't have the symptoms. The treatment's been around for about 100 years and it's used all over the world, but not so much in the UK. And allergic people with hay fever make antibodies, which are called IgE antibodies, to pollen proteins. And what the treatment teaches the immune system to make different antibodies, IgG4 antibodies, to the pollen proteins instead. And these new antibodies then compete with the allergic antibodies and redirect the immune response. Immunotherapy is safe for children, and most children will have some side effects with the treatment, perhaps a tingly tongue or sometimes an itchy throat, and that can last just a few minutes. Disease side effects are usually reported at the beginning, but not usually beyond 6 weeks. If you have symptoms or during treatment, we may pause your treatment for a while if they come back. There's a very small risk, about 1 in a million, of anaphylaxis, a severe allergic reaction, although this is more common with an injectable type of immunotherapy, which I'm not offering. There are risks for those who with severe or uncontrolled asthma, and this group is not recommended to have immunotherapy. And fish allergy is also a relative contraindication to some brands. Well, immunotherapy is being used in studies on children from as young as 4 years of age, but the licensed treatments, depending on which product, are from 6 years or 12 years of age, depending on the preparation. You can use lots of products off license, but they're sometimes difficult to administer in the younger children. So usually 6 is a good cutoff. Most children will see the biggest improvement in their hay fever symptoms during the first year of treatment, and then a further improvement in the second season, with much less in the third year. But taking the treatment for the third year is important because that does improve the long-term outcome, and it means that your hay fever will be kept away for at least 5 years with no deterioration after the treatment is finished. Well, it depends on how you measure success, I suppose. After 3 years, about 15% of those who are treated will not require any treatment for their hay fever. But those who were requiring regular treatment with either a nasal spray or an antihistamine, they will go down to just intermittent treatment. And there's also some evidence of improvement in asthma symptoms in those with mild asthma or seasonal asthma. The success also depends on how well you take the treatment. So those who take the treatment every day will see the biggest improvement. If you're not very good at taking the treatment or take it erratically, it's less effective. And it's also important that the treatment is started 3 months before the pollen season for the most effect. Also, it has an effect on education, and there is evidence that in children doing their GCSEs, those who have hay fever may drop an exam grade during the pollen season exam in comparison to their mock exam in the winter time.